Hi everyone, welcome back to ADC Aspirants. I'm Dr. Henna. Today's video is about the top 3 tips that work really well for many candidates and worked for me as well for the objective structured clinical examinations. In short, the OSCEs. Number 1 tip is to structure your answers really well. What does that mean? Simply just explaining conditions like dental caries or periodontitis or cracked teeth, etc., in very simple language, which is easy for the patients to understand. That's exactly what framing your answers or structuring your answers mean. Don't just memorize, but explain in a way that the patient does not even have to ask you the second time around about what it really meant. This really helps you in keeping your communication effective. The second tip is to listen actively. Yes, take a pause. Sometimes actively listen to the patients as to what they're actually trying to tell you. We are always in a rush to finish our content and focus on the time more than what the examiner or the patient is saying. I think it's important to take a pause at times, and even if you're not able to understand sometimes what they said, or if you forgot maybe, it's always a good thing to ask them to repeat what they said. It means that you're actively listening to them and not just completing your content based on how much time you have left. And the most important tip, which worked really well for me as well, is to face yourself in the mirror every day and practice your OSCEs. Yes, you heard it right. You don't always need to have a study partner to talk to and understand where you're lacking in your preparation. The mirror can give you a lot of feedback, believe me. So whether it's your framing of answers, structure, content, time management, start practicing with yourself in the mirror and see how much confidence you have in explaining things to yourself in the most easiest manner. These are my top 3 tips for the OSCEs, but if you want to get to know more about the written part of the OSCEs, feel free to reach out to us. Thank you for watching.